Change to the law. Team Obama is issuing yet another delay, another unilateral change to Obamacare. This time it's part of the law that prohibits employers from providing better health benefits to top executives. You see, to Obama, it's a one-size-fits-all, top-down, authoritarian, government control world. Obamacare calls it discrimination if you have a better health care plan than me. The problem is the IRS can't enforce the provision because there are no regulations yet for employers to follow. So more regulations will be coming. Imagine that. Meantime, Senator Ted Cruz continues his quest to repeal Obamacare.
I rise today to speak of pragmatism and irresponsibility. 4 years ago, when this body was debating the law known as Obamacare, reasonable minds perhaps could have differed as to whether that law might work. The essence of pragmatism is looking to the facts as they are today and responding. Today, reasonable minds can no longer differ in terms of whether Obamacare is working. Today, it is abundantly clear that millions of Americans are being harmed right now by this failed law.
The numbers show a strong pushback from the American people on Obamacare. A steady majority want Obamacare either changed or repealed. But what else do we not know about this law? Joining me now, private medicine advocate and Obamacare expert Patricia Newman. Patty, this coverage is called the equal coverage provision. It's the one that won't allow an employer to give a top executive a better health care plan than somebody, I guess, below that executive. I guess they call that discrimination in Obama's world. I call it socialism. I mean, it's goofy, but I guess once again, Nancy Pelosi was correct. We had to pass this law to know what was in it. I
know. Every time I hear that phrase, I keep thinking of a stool sample sent to the lab. I'm sorry about that. But yeah, this employer regulation that has not yet to be written is because they can't figure out what exactly is a top employee. Yeah. I think they're kind of worried. You remember when D.C. was complaining that they were going to have a brain drain in D.C. if they were offered Obamacare? This is kind of the same thing, you know. The employers tend to use benefits to attract talent. Now the government is telling them you cannot give them a better policy.
Right. It's completely un-American.
Yeah,
right?
And the other problem that the employers will face, let's say, okay, fine, then we'll pick a top-of-the-line policy for everybody. What if the employees cannot afford that policy? If they pull out of the policy, if they enroll in Obamacare, remember there's that employer penalty.
Right.
So if you offer policy and the employees cannot afford it, you will be penalized. I mean, so what do you think employers are going to do in response to this? This is in a capitalistic society. An employer is going to cut everybody's hours and not to have to deal with it. So
right.
If you think we have bad unemployment numbers now, as opposed to what the reported unemployment numbers are, this is going to get a lot worse.
Yeah, and they're going to shove them into Obamacare and say the heck with it. Now, the government says a little over 2 million people have enrolled. We don't know exactly the definition of the word enrolled. Do we know how many of those enrollees had their previous health care plans canceled?
We don't really know. The number that we do know is that only 11% of those that enrolled did not have insurance before. So that's a very telling number. This is not fixing the problem that Obama was trying to fix. This is only attracting the older, the sicker patient to enroll and not to solve the problem of uninsured or the supposed problem of uninsured Americans.
Now, we also know that 79% of the folks who are signing up are getting subsidies.
Yeah.
Well, I'm sorry, it doesn't, again, take a rocket scientist to figure out that that model is unsustainable, at least at this point.
It is unsustainable. You add that to the small number, which is like anywhere from 24 to 30% of the young, healthy population that has actually signed up, versus these people that are receiving subsidies. You know, this will end up in that death spiral that we all have been talking about, because it is unsustainable. In Oregon, 100% of the people that signed up are getting subsidies.
That's crazy.
Absolutely crazy.
That is unbelievable. And in the meantime, the overall enrollee numbers are way lower than where they need to be. And what the administration keeps saying is, hey, we're going to have a last-minute push. All these young people are going to suddenly sign up. I don't buy it. I would be willing to bet $1,000 right now that that overall doesn't happen and they don't get the numbers that they actually need. But you can point to Massachusetts for what happened there. Tell us about that.
Well, in Massachusetts, the last few months of when they implemented Obamacare, the last, the end of the enrollment period is when the majority of the healthy people signed up. I still don't believe that Obamacare is a positive example. I understand that state has its right to implement whatever plan they want to do, but what they haven't told you is that Massachusetts has been federally subsidized, which means you and I and all other states in the union have been paying for Massachusetts' failure. That part they never tell you.
So we're subsidizing another Obamacare scheme.
Right, we are.
It's amazing. It keeps getting worse and worse. Thanks, Nancy. And thank you, Patty.
Thank you.
Coming up next, the Chris Christie scandals widen as the Daily Ledger continues.